Martha was 72 when she first noticed she couldn't open jars anymore. She blamed arthritis, but the real culprit was silently stealing 3% of her muscle mass every year. By the time she realized what was happening, she had already lost 30% of her strength, a loss that would change her life forever. Her story is just one of 5 hidden health risks I'm revealing today, conditions that affect millions of seniors but rarely make headlines. If you or someone you love is over 65, this video could be life-changing. These risks don't just creep up on you. They strike silently, often disguised as normal aging. But the truth is, they're preventable, treatable, and worth understanding. Sarcopenia, the silent muscle thief. Have you noticed everyday tasks becoming harder? Grocery bags feeling heavier? Chairs harder to get out of? The culprit might be sarcopenia, a progressive loss of muscle mass that affects up to half of all seniors over 70. Yet, most have never even heard the term. Take Martha, for example. A 72-year-old retired teacher, she first noticed changes when her grocery bags felt unusually heavy. She dismissed it as just getting older and found workarounds, asking for lighter bags, making more trips to the car. A year later, she struggled to rise from her favorite armchair without pushing up with her hands. Still, she adapted, placing firm cushions on chairs to sit higher. It wasn't until she fell while walking to her mailbox, unable to catch herself quickly enough, that Martha realized something beyond normal aging was happening. That fall resulted in a fractured hip, 2 months of rehabilitation, and a permanent loss of her cherished independence. The science behind sarcopenia. Starting at age 30, we naturally begin losing muscle tissue, initially at a modest 3 to 5% per decade. However, after 60, this process accelerates dramatically. By the time someone reaches 80, they could have lost nearly a third of their muscle mass compared to their younger adult self. What makes sarcopenia particularly dangerous is the vicious cycle it creates. As muscle mass decreases, mobility becomes more difficult. When movement becomes challenging, people naturally move less. This reduced activity then accelerates further muscle loss, creating a downward spiral that can rapidly erode independence. The warning signs: struggling to rise from a chair without using your arms. This seemingly simple action requires significant lower body strength. If you find yourself automatically pushing up with your hands, that's a red flag. Difficulty lifting everyday items like a gallon of milk or a small vacuum cleaner. These changes in functional strength often indicate significant muscle loss, a noticeable slowdown in walking speed. Research shows that a decrease in how quickly you can walk across a room correlates strongly with muscle loss. The good news: unlike many age-related conditions, sarcopenia can be identified early and effectively managed. Proper nutrition plays a crucial role, particularly protein intake. Many seniors don't consume enough protein to maintain muscle health, with research suggesting that older adults need more protein than younger people, about 1.0 to 1.2 grams per kilogram of body weight daily. Equally important is strength training, which remains effective well into advanced age. Resistance exercises using light weights, simple body weight movements like modified squats while holding onto a sturdy chair, and balance training can all help preserve and even rebuild muscle mass. These activities don't require gym memberships or complicated equipment. They can be adapted for nearly any fitness level and performed at home. If you're still tuned in and finding value in these ideas, type 1 in the comments to shout out that you're part of this journey. For those who haven't yet, smash that subscribe button and tap the notification bell to stay updated with every new video. Your engagement drives us to keep crafting content that sparks curiosity and fuels growth. Now, let's dive into the next hidden threat, a swallowing problem that's deadlier than most realize. That occasional cough during meals might seem harmless, but for 15 to 22% of seniors over 70, it signals a potentially life-threatening condition. Silent dysphagia. When functioning properly, swallowing is an intricate ballet of muscle contractions that direct food and liquid safely down your esophagus and into your stomach. When this system falters, the consequences can be severe. Take Robert, for instance. At 78, he'd been experiencing occasional coughing fits while eating dinner with his family. "It's just going down the wrong pipe," he'd assure his concerned daughter. These episodes became more frequent, but Robert dismissed them as a normal part of aging. 6 months later, he developed a persistent fever and chest congestion that sent him to the emergency room. The diagnosis: aspiration pneumonia, a serious lung infection caused by food particles entering his lungs instead of his stomach. The mortality rate for aspiration pneumonia in seniors is a staggering 30%. The science behind dysphagia, research involving over 1,000 patients, revealed that those with dysphagia were 5 times more likely to develop pneumonia and required significantly more medical visits compared to others receiving home care. Yet, despite these risks, dysphagia remains largely undiagnosed because its symptoms are easily attributed to other causes. Weight loss gets chalked up to poor appetite. A hoarse, wet-sounding voice after meals? Just another sign of aging. Frequent throat clearing during dinner? Probably seasonal allergies. These misattributions allow dysphagia to progress silently until a crisis occurs. The warning signs: coughing during or immediately after eating or drinking, a wet-sounding voice after swallowing, sensation of food sticking in the throat, unexplained weight loss. The solution: simple modifications to how and what you eat can significantly reduce your risk. Thickening liquids is one of the most effective interventions for many people with dysphagia. This seemingly minor change makes swallowing easier and helps prevent liquids from entering the airway. In Robert's case, after his hospitalization, a speech therapist taught him to slightly tuck his chin while swallowing and prescribed thicker liquids, which dramatically reduced his episodes of coughing during meals. If you're still tuned in and finding value in these ideas, type 2 in the comments to shout out that you're part of this journey. For those who haven't yet, smash that subscribe button and tap the notification bell to stay updated with every new video. Your engagement drives us to keep crafting content that sparks curiosity and fuels growth. Next up, a hidden danger lurking in your medicine cabinet. Nearly half of seniors take 5 or more medications daily. But what many don't realize is that each additional pill increases the risk of harmful reactions by 10%, creating a dangerous domino effect that can compromise your health rather than improve it. This phenomenon has a name: medication cascades. It occurs when side effects from one medication are misinterpreted as symptoms of a new condition, leading doctors to prescribe yet another drug, which brings its own potential side effects. Before long, what started as treatment for a single health issue transforms into a complex web of prescriptions, each one potentially triggering new problems. Consider Eleanor's case. At 72, she began taking medication for high blood pressure. Within weeks, she experienced persistent dizziness, a common side effect of many antihypertensives. Rather than adjusting her original prescription, her doctor prescribed an anti-dizziness medication. Soon after, Eleanor developed severe constipation from the second drug, which led to a prescription for a laxative. One initial condition had spawned a 5-medication cascade, with each new drug addressing a problem caused by the previous one. The science behind medication cascades. This pattern is particularly problematic for seniors because our bodies process medications differently as we age. Your liver and kidneys, the organs responsible for metabolizing and clearing drugs from your system, become less efficient over time. This means medications stay in your bloodstream longer, potentially reaching higher concentrations and causing more pronounced side effects. Common medications like antihypertensives, sleeping pills, and anticholinergics, found in many allergy and bladder control drugs, can be especially troublesome for aging bodies. The solution: Create a comprehensive medication list that includes everything you take: prescription drugs, over-the-counter medications, supplements, and vitamins. Request a comprehensive medication review with your healthcare provider or a pharmacist specifically trained in geriatric medication management. Ask 3 crucial questions about each prescription. Is this medication still necessary? What would happen if I stopped taking it? Are there non-drug alternatives that might work just as well? If you're still tuned in and finding value in these ideas, type 3 in the comments to shout out that you're part of this journey. For those who haven't yet, smash that subscribe button and tap the notification bell to stay updated with every new video. Your engagement drives us to keep crafting content that sparks curiosity and fuels growth. Now, let's talk about a risk that's rewiring your brain. Sensory decline, the brain's silent enemy. Turning up the TV volume or needing brighter light to read might seem like minor annoyances, but they're early warning signs of sensory decline, a major risk factor for dementia. When your senses fade, your brain is forced to fundamentally reorganize itself, and not in beneficial ways. William's story illustrates this hidden danger all too clearly. A retired professor with a rich social life, William first noticed difficulty following conversations at his weekly bridge club. Rather than addressing his hearing loss, he made excuses to avoid social gatherings, where following multiple conversations became challenging. Within just 2 years, his family noticed not only his increasing isolation, but also alarming changes in his memory and cognitive function. What William didn't realize was that his brain was being forced to work overtime just to process basic auditory information. The science behind sensory decline. Untreated hearing loss increases your risk of dementia by a staggering 94%. Despite this revelation from recent research, only about 1 in 5 seniors who need hearing aids actually use them. Vision impairment follows a similar pattern with equally serious consequences. Research has revealed that something as straightforward as cataract surgery can reduce cognitive decline risk by half in seniors who undergo the procedure. The solution: commit to annual vision and hearing screenings regardless of whether you've noticed problems. When issues are detected, seek immediate intervention. Don't wait until conditions become severe. Explore the full range of adaptive technologies available today, from hearing aids to smartphone accessibility features. If you're still tuned in and finding value in these ideas, type 4 in the comments to shout out that you're part of this journey. For those who haven't yet, smash that subscribe button and tap the notification bell to stay updated with every new video. Finally, let's tackle a risk as deadly as smoking. Social isolation, the invisible killer. Loneliness increases mortality risk by 29%, as dangerous as smoking 15 cigarettes a day. Chronic isolation triggers inflammation, weakens immunity, and accelerates cognitive decline. When we think of health threats, we usually picture viruses, bacteria, or lifestyle factors like diet and exercise. But the human body reacts to social disconnection with the same biological alarm systems it uses for physical danger. James, a 78-year-old retired accountant, lost his wife of 52 years. In the months following her death, his friends noticed more than just emotional grief. His blood pressure spiked, he developed shingles, and he caught every virus circulating. Within 18 months, this previously healthy man was hospitalized twice with pneumonia. His doctor initially attributed everything to age and grief, missing the underlying physiological cascade triggered by sudden isolation. The science behind social isolation. The chronic stress of loneliness floods your system with cortisol and other stress hormones that directly damage your cardiovascular system while simultaneously suppressing your immune function. This same inflammatory process attacks brain tissue, which helps explain why isolated seniors have a staggering 64% higher risk of developing clinical dementia. The solution: engage in purpose-driven activities that connect you with others around shared goals. Cultivate reciprocal relationships where you both give and receive support. Develop a sense of community belonging through religious institutions, neighborhood associations, or interest groups. Take action today. Now that you know these 5 hidden risks, take a moment to reflect on where you stand. Are you moving through life with strength and confidence, or have you noticed subtle changes that might be warning signs? The good news is that these risks, sarcopenia, silent dysphagia, medication cascades, sensory decline, and social isolation, are not inevitable. You have the power to take control and make meaningful changes starting today. If you've recognized areas where you need to improve, don't wait for a crisis to make a change. Start now. Try lifting a full grocery bag to gauge your strength. Struggling with this simple task could signal muscle loss. Pay attention to how you swallow during meals. Review your medications with your doctor. Get your vision and hearing checked regularly. And nurture your social connections. They're as vital to your health as diet and exercise. The goal isn't just to live longer, it's to live better. Because at the end of the day, longevity isn't just about the number of years you have left. It's about the quality of life you experience in those years. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement to keep creating content that informs and inspires you. If you enjoyed this video and found it helpful, please like, subscribe, and share it with someone you care about. Your support helps us continue crafting meaningful content that makes a difference. Thanks for watching, and we look forward to seeing you in the next video.